A new study finds coronavirus patients taking the anti-malaria drug hydroxychloroquine. They're no less likely to need ventilation than patients who were not treated with the drug. That's according to the U.S. Veterans Health Administration medical centers. The study also found there were higher death rates among those who took the treatment and those that did not. The state of Utah about to purchase hundreds of thousands of doses of this malaria drug for COVID-19 patients. There's no evidence at this point that the drug can help patients with the virus. Our Christina Flores has more on this big purchase. How much will the state spend on the drug, and why are they doing it if there's not really proven that it actually works, Christina?
Well, Mark, they are not saying. The state health department says the contract or the purchase contract is not finalized yet, so they can't tell us a price at this point. We do know that the state is buying the drugs from a company called Meds in Motion. Again, the state is buying a lot of this, enough to treat 200,000 patients here in Utah. Hydroxychloroquine is used to treat, of course, malaria and also other diseases like lupus and rheumatoid arthritis. State epidemiologist Dr. Angela Dunn says there were some reports early on out of China that the drug might help coronavirus patients. There are studies underway here in Utah at the University of Utah and at Intermountain Healthcare. There are other studies going on around the country, but so far there is no proof that this drug helps COVID-19 patients.
What the state did was purchase a large quantity of these drugs so that if there are providers in Utah who want to treat their patients who have COVID-19 with hydroxychloroquine, they have the capacity to do so. So these drugs will be distributed through pharmacies, no charge to the patients, and if a prescriber does want to prescribe it to their patient, they're able to do so.
Alliance for a Better Utah issued a statement about this big purchase. The statement says, aided by Senate President Adams, public funds will pay for a private gamble by Meds in Motion that would result in putting some Utahns' health at risk. Medical professionals have expressed serious reservations with unsupervised off-label use of anti-malarial drugs, and yet lawmakers are playing politics and bankrolling one individual's speculative business decision at the risk of Utahns. So again, that's Alliance for a Better Utah expressing concern about the purchase of this drug. Mark, back to you.